Hello and good evening to yet another episode of the Health and Wellness Show. Na kama kawaida na kuelimisha, we inform you, we empower you and we inspire you to take full control of your health and live your best life. Na leo tunaongelea about maternal health. We'll talk about labor, we'll talk about delivery, we'll talk about prevention, yani prevention of diseases ama kila things that zinaweza fanya wanawake kufa during childbirth. In short, we are talking about maternal health in general, preconception, during the pregnancy journey, how to handle that pregnancy, and also of course, after delivery, what happens. And of course, the topic is very important, Kwanini, because at the moment in Kenya, in as much as kumekuwa na a lot of improvements over the last 10 years, we also have challenges. And of course, we have our guests in studio. Na leo ni kikao cha wanawake. Hakuna a man here because we are talking about motherhood, pregnancy journey. Na ni wamama tu. Leo ni akina mama. Karibuni sana to the show.
Thank you.
Wamama, hi. Wamama, chalala. All right, so to my extreme left is Christine Koome, who is a mother and a nutritionist. And hapa karibu na mimi ni Daktari Odhiambo Nderitu, ambaye ni daktari, midwife, na pia ni researcher. She's a lecturer in the university. Of course, my name is Chebet Birir. And once again, karibu sana to the show. Now, what is the state of maternal health in the country? We have about more than 380 deaths per 100,000 births. That means for every 100,000 mothers when you want to deliver, about 400 of them die. That is a big number, Daktari, and you'll help us put that into perspective. And this also means that more than 5,000 mothers, actually, every year, they die due to childbirth-related complications. So this conversation is very, very important. But we also have fun. I mean, tutakuwa na stories, hizo stories za labor. We are all mothers here. Nimesema tu ni wamama hi. Wamama tialala.
Asante sana. We are humbled.
So we start with Christine. Christine atatueleza her story. She's also a nutritionist, so uko towards the end, she'll explain to us the do's and don'ts in nutrition and lifestyle. But first, tuambie Christine, you're a mother of 2.
Yes.
Na daktari ni mother of 2, na mi mother of 3. So hapa leo ni motherhood too. Sure. So Christine, tueleze, how was it before you delivered? Ulikuwa umejipanga? Unajua tunataka kujua kwanza before you conceive. Yes. Ulikuwa aje? How were you prepared for it?
Kuongea kweli, I was not prepared in that case because I was about 7 months. That is 34 weeks. 34 weeks. I was 34 weeks, so I was not ready for it. Bado nilikuwa najipanga mdogo. So hata sikuwa nimemaliza.
Wacha hata 34 weeks. So umeenda mbali. Before ulipima your pregnancy, before ukue pregnant.
I knew I was pregnant within the 2 weeks. The 2 weeks I knew that I was pregnant, and it was.
What was your reaction?
I was happy.
You were happy?
Because I expected the second kid before I get to 30s. Yeah, so I was
How old were you?
30.
You were 30.
Yeah.
Kabisa.
So if I would start to that, I was in fear that something will not be good there. So I was very happy to know that I'm pregnant, and I knew after 2 weeks, and I started taking precautions, visiting the clinics, the antenatal clinics, and I was very, very much ready. But between there, I started becoming very, very, very tired, fatigue.
At what age? At what trimester?
Yes.
Did you start getting tired?
Second trimester.
Second trimester.
Yes, but I didn't know why. I just was just knowing that it is the weight gain. The kukula sana hapa na pale, you know, every time you are there you want a lot of wheat, and also the processed products that we should not be taking during the pregnancy. I was taking a lot of Coke.
Coca-Cola.
Lazima ingetoka kwa fridge, ikuwe baridi. Hata ningenunua watermelon hivi, you would feel that lazima ingie kwa fridge kidogo. So at a moment I didn't know if it was about to mess me up. that's when I started feeling I'm not okay. So I needed a specialist, gynecologist now.
Achia hapo kidogo tu.
Tutafika
hapo. But sasa daktari atueleze hapo kwa preparation. You are a midwife.
Yes.
Na wengi wetu, hata me included, mi wanajua midwife ni wa huko mwisho wakati wa delivery. But what is your perspective in terms of women preparing for conception, not labor, not the pregnancy, conception, just before you conceive that child?
Thank you very much.
What should you do?
Thank you very much, Biril. And I would like to start, even before I go to preconception care, I would like to say that behind every statistic that you've just mentioned as you began, we realize that there's a mother behind it.
Yes.
And behind that mother, there is a family. And also there is a community that at the end of the day, they get affected by all this.
Yes.
So this is a very important topic. I just wanted to affirm that at the beginning. Now, let's talk about preconception care. Preconception period is very, very critical. Let's start from there. And we need to acknowledge the fact that it is very, very difficult for most of us to plan. Normally, we say start planning for your pregnancy between 3 months and 1 year. Birir, I'm coming to you. Between 3 months and 1 year. How many of us do that? This is the time we want to check if you're okay, if your health is okay, if you need to be put on some supplements, if you need to be carried out some counseling so that you get ready for your pregnancy. But trust me, a good percentage of us watching us and even here, among us here, none of us have done preconception care. Now that gap is so big, we need to do something about it.
Yes.
So most women don't prepare. But you see, at the end of the day, there's a lot that comes in the preparation, including your psychology, including your physical, health-wise, everything. There are a lot of factors that come together when it comes to you preparing for pregnancy, because pregnancy itself comes with a lot of changes as well, physiologically, mentally. So if you are not ready, and maybe at some point we need to even talk about the young teenagers who get pregnant.
Moms, yes.
So what I want to say is that that is one aspect of maternal health care which is totally ignored and neglected.
So what do you think, for example, I didn't prepare me, I just discovered I was expecting. And then, of course, having Google as my friend.
Google as your friend.
I am 2 weeks expectant. What should I do? So I started going for antenatal clinics. But what really happens, like you've said, with most teen moms, wanaogopa hiyo stigma. Sasa hataki kwenda clinic. Kome, butueleze, how was it with you? Considering now you are married,
Yes.
You've discovered you're 2 weeks expecting a child. What preparations did you do?
Antenatal clinics was the first thing. And I was very eager to know about the gender.
As it is with of course, almost every mom.
With the gender, I was very, very much very keen about the blood pressure, because that thing about the history in Akwanga, we are not okay with that. So I was very much keen with the blood pressure, feeling that feeding, working because of the heavy things. Yeah, so I was very keen about what I was doing, the exercises that I could take. I was walking a lot instead of picking cabs and motorbikes. Yeah.
Okay.
Sawa. So daktari, what should we do? Like umesema before conceiving, tuanze tu na the physical aspect. How should we prepare physically? Then we go to mentally.
Okay. So the preparation encompasses a lot. When it comes, once you realize you're pregnant, there's a lot that comes in your preparation of how to walk that journey, because it is a journey. And this journey is not easy, because at the end of the day, you realize there's a lot that happens to this woman in terms of the changes that even her herself may not be able to understand. You know, we strive to understand pregnant women so much, but trust me, even them themselves, they may not be able to understand themselves. So what exactly do you need to do? First of all, like I said, you have to be psychologically prepared for the journey. You are going to be a mom, and you need to walk this journey in a lot of readiness. Go to the clinic. Go for your first clinic. These days, we advocate for 8 visits. And you know, we used to go for 4 visits, but now we go for 8 visits. That tells you how important it is for you to go to the clinic. So when you're able to go to the clinic, that is when you will be advised. You'll be told we need to carry out some tests on you. We need to advise you on how to care for yourself during pregnancy. How do you go about your daily activities? Do you need to eat this? There's a lot, health education messages and all that. Now, when we are taking care of women during the antenatal period, let me just briefly talk about the objectives, so that you can be able to see the magnitude of what we are talking about here today.
Yes.
Number 1, we have to do early detection and treatment of illnesses. Number 2, we have to do health promotion. We have to do prevention, and there are some supplements that you'll be given. There are some medications that are given during pregnancy, like the folic. Folic is very important. Ferrous is very important. We also have to make sure that this woman is prepared. We call it individual birth plan and complication readiness. Now, that is the part I'm waiting for us to discuss, where we are talking about complication readiness.
Yes.
There, we got it all wrong, because sometimes we can't identify. How can I know I am okay when I go back home?
Yes.
How will you know if you've not walked into a clinic? Someone is there waiting for you. And that is why me as a midwife, me as a healthcare provider, the first time I'm meeting Kome, the first time I'm seeing you, Birir, I will take care of you like it's the first and the last time.
Yes.
That is why we call it personalized care. It is personalized. All women have different experiences, and you cannot generalize their issues. That is why they need to be walked in. If they don't appear, and of course, Birir, there are women who don't show up to the clinic.
Yes,
they only come to confirm, is my baby okay? And they wait for the date of birth.
And you are so right, because even now, I mean, kuna Google. Why should I go to the clinic?
Why should you go to
Google
the clinic?
everything
Yes.
and know everything? And I also agree with you, ukisema hapo, that so many mothers, expectant mothers, don't
Yes.
even know what is happening to their body. In my first pregnancy, I was just newly employed somewhere, and so there was a meeting. Lafu nikakuwa overly emotional in the meeting, siku hata nimejua I'm expecting a child.
Wow.
So something was said, and I actually cried in the meeting. Kumbe it was hormones zinanionyesha dust. And then later on, you missed your period, and then oops, you're pregnant. So I agree with you, Kisema. Many mothers don't know what is happening. Christine, how was it with you now? You've realized you're pregnant, you've started going for clinics. How was the journey between 2 weeks and 34 weeks now before you were diagnosed with preeclampsia?
Thank you. It was very tough, very tough. Apparently, I was becoming very angry.
Ningekasirika.
Hormones. Ningekasirika sana. Kitu kidogo inaniudhi. Nakwambia nisaidie leo niletee samaki. Ungekosa samaki kwa nyumba yangu, then we would fight. So it was a little bit very tough, but I thank God. And also it was not so easy, because sometimes I would even embrace someone in the house and I feel that something is not going the way I want it to be. So I felt like they were not taking the things that I would do myself to a perfect way, then they are not done well. Food
irritability
itself.
On the high.
Yes. On top.
Because of course your
mood
hormones are not
swings and
normal.
hormones.
The food itself, I was okay with it, but haungenipikia. I would cook my own. If I feel like eating mandazi today, I'll wake up at 4. Imagine at 4 a.m. Yes.
Mtoto ameamua ni mandazi
sasa mandazi. The breakfast was so good. And you would think someone was telling, our friend was telling us, hiyo nyumba imekuwa hoteli. And I don't know what I could say, but I was okay. Jirani akipita namwambia karibu. But ikosea kidogo unikanyange. I would be there. Fire. The pressure was a bit high, and I could manage it through the medicine, the medications. And also when I started becoming big, swelling, that was swelling. Yes. I didn't know it was swelling. But when I started, I thought the kgs
you thought
and
it's weight gain.
And it's
normal.
normal.
And actually it's expected.
And you talk about that.
Yes.
It was normal. Nikitembea sana, miguu, the kind of the legs was so big than even myself. So I could not expect that I'll be okay at any particular moment. So I started becoming worried. I started being worried every time. Nikitembea, nikienda job, I think of, something might happen. Something might happen. But I didn't know if it was all about
preeclampsia, which we'll talk about baadaye kidogo. But Christine, before we come to you daktari, what were your expectations? Unajua kuna expectations versus reality. Vile vitu ziko na vile ziko kwa ground. What were you expecting?
I was expecting I was normal, very normal. I didn't even know kama
kuna kitu inaitwa preeclampsia.
Yeah, I was reading about it on the Google, by the way.
But unajiambia it can't be
me. It
can never be me.
No, because it is one in about 10. So it was not me. The pressure itself was not okay, but I thought it was normal because I am pregnant. Also the blood issue, it was a bit low. Ilikuwa 10 hapo. So I didn't know. I thought it was okay. But at normal age, unaona inasomanga 13.5. So I was a bit worried about it.
Okay.
Yeah.
Asante sana Christine for sharing your story mpaka hapo. Na bado. But sasa tuende kwa daktari sasa, from your professional experience.
Yes.
Ama tuanze na personal experience.
Personal.
Juu sasa wewe pia umeniingilia kidogo. Acha pia mimi kuingilia. How prepared were you? How prepared were you for pregnancy?
Okay, now that you've decided to attack me and on stage, let me just proceed and give my experience. Now, this is what happened. And you will find it very interesting because I'll tell you, Biriro, even as medical who are in the medical practitioners who are practicing, I tell you some of these things, I think they are Greek to some extent. But let me say, I'll probably give one or two. Now you see, for my first pregnancy, it caught me off guard completely. And I just found myself, I am pregnant and I'm already there with a baby. And I was so much depressed because I didn't know how to carry myself out with this baby and everything.
How old were you?
I was 24.
You were 24.
I was 24.
Me too,
yeah, but I wasn't
child.
prepared. I was completely not prepared for it. And you see there, I'm saying sometimes you're caught off guard and you realize I'm just pregnant and the pregnancy is there and you have to completely shift your mindset and say,
changes.
soon I'm going to be a mom.
Yeah.
All right?
Yeah.
So that caught me off guard. Then I told myself, I prayed. Please God, give me another child so that I start preparing the way I teach in class 3 months to 1 year so that at least I prepare. And actually for my second baby, it was on point.
That was an interesting prayer.
1 year, I prayed. 1 year down the line, I was already taking supplements, going for counseling, going for tests, and I was ready. So I did it practically and I can tell viewers it works.
It works. So kwa hivyo unasema as you pray for a child, prepare for that child. Thank you so much. Sasa natueleze sasa from your professional experience.
Yes.
What are some of the common challenges zenye women or mothers come to you with zenye unaona this would have been avoided if you would have prepared for this delivery?
Okay. So let me still go back to the issue of birth preparedness. And this is what I want to say. Most of the causes of maternal mortality are quite preventable. Actually, they are very preventable. It's just that sometimes we are too late to diagnose and the people we are diagnosing also have not been educated on it. So you realize that how we can achieve this. How can we achieve this? Number one, we can have it in levels. You know, when you talk about maternal health and childbirth and all that, we have it in levels. So from the time this woman is actually preparing for conception and she's actually walking her journey through pregnancy, then we have another part where we are talking about labor and delivery. And then there's that part of postpartum, which should be done with a skillful, we call them skilled birth attendants, and also with a lot of respect. That is a concept we call in maternal health, respect maternity care.
Yes.
So when we have this in mind, then we are able to address most issues. Most clients who come who are affected by this, or maybe they are not able to maybe get good services, is because of their situation. You'll realize poverty is the leading. And when you look at even rural sub-Saharan, the deaths are shooting. Every time we have very high rates of deaths of women, and you're wondering what is really happening. It's because we have not accessed them. Probably they don't even know they can access services in the health facilities. Now, number one is poverty. Number two is with things to do with malnutrition. Gender inequality, that is a big issue. Then now the biggest issue is lack of knowledge, awareness, education.
Sometimes unaweza sema ni ignorance.
I don't even know if it is ignorance, but let me just put it as lack of information. People are not informed, people are not educated, people don't know what to do.
Yes.
They are caught off guard and they don't know where to start from. Now, I'll flip the coin a little bit. Now, they are not prepared. What about us on this other end?
And that question I don't want you to answer now.
I will
Why?
not
Because
answer.
Christine, atueleze, when you went to hospital, and thank you so much so far. When you went to hospital, how were the nurses there treating you? How were the doctors there treating you? Because also one of the major causes of maternal deaths is lack of proper care at the health facilities. How was your case, Christine?
My case was very much different because I chose to go to those highly presented hospitals. So I had higher expectations about my pregnancy journey. So I expected everything to be perfect. At the first clinic, I went at the hand that being of lazima tukuchukulia sasa the scan kadogo tujue vile huko if you are okay, the body, the position. And I was very much okay. The second antenatal clinic was not very nice because I was not told the truth. At the back of, below my nib, I was feeling a lot of pain. If I go to the tap, I cannot open the sink.
Moving was hard.
Yes, and they told me it was a diaphragm problem because the kid now is growing big and everything. She's going. They are going to be large, and the weight is going high, and the weight was shooting very fast because I would add 4 kgs at every month. 4 kgs every month. And I thought I was overfeeding, but it was not the case. It was different. So the moment I was told it was a diaphragm problem, that was when I decided to take a gynecologist of my own.
Okay.
When I took that, it was even different more. Because that gynecologist lazima patikane masaa fulani. Hiyo masaa sipatikani.
On appointment basis.
Yes. That is when I'm feeling sleepy. Hata kazi siingi.
Utaki kuona mtu.
Yes.
Na ndio appointment ni hiyo.
Your appointment ndio hii. Kwa hivyo I'm lazy about that. Yes. You see?
Yes.
So I was nalala. Kukikuwa na baridi nalala. But I didn't know it was danger to my kid or myself. So when I realized that it was a preeclampsia, actually, it was very late.
How late was it, Daktari? I understand you were there with her. First of all,
so much there.
Now that we are here, we can't wait for the second segment to talk about it. What is we had planned to talk about preeclampsia.
I know,
after the break, but just tell us and then we'll dig deeper into it. What is preeclampsia exactly and what are the signs and symptoms? Najua Christine amezisema sema.
Yes, of
but
course.
Please emphasize on them.
So preeclampsia is one of the main hypertensive. We call them hypertensive disorders in pregnancy, and it normally occurs. It's very typical with pregnancy. You will not have preeclampsia before pregnancy or and after, but sometimes it resolves like 12 weeks after the pregnancy. So there are women who actually still have symptoms even after. It is characterized by high blood pressure. For those who understand me at this point, we are talking about pressure of 140/90 millimeters of mercury. It's also characterized by edema, generalized edema. Now, get me right. If you're a mother watching me from out there and you're pregnant, get me right. I'm not talking about the edema that occurs only on the feet. This edema is generalized. When I say generalized, it's on the feet, it's on the upper extremities, the arms, it's on the face. In fact, if you're very keen in the clinic, when a woman is walking in, you can actually just pick it directly when her face is very puffy. It is very distinct. And of course, again, it is characterized when we do our urinalysis test, we get protein in urine. So one or two, at least if we get 2 of these parameters, you are sure. There are other symptoms where you have some pain or under the, Christine, you had that? Pain under the left side, under the rib, So also that one is very typical. And at the end of the day, with preeclampsia, if it's not identified early, and you see, I'm still going back. If we don't go to the clinic, how will we know your blood pressure? At the end of the day, you will have high blood pressure and we will not be able to know. So we will take your blood pressure and we have a way of recording it in your maternal booklet so that we know if there's any deviation from the normal. So that's basically preeclampsia, and it can be managed. It can be managed. Yes.
If you detect it early.
If we detect it early, it can be managed.
Mama twende clinic. Don't use Google.
Don't use Google. And
Google
you see,
will just guide you, but in pregnancy you will definitely add weight. So inaweza kuconfuse useme like Christine, maybe she thought it's pregnancy weight gain ya kawaida.
Definitely I was confused.
But now you see she had preeclampsia and you're saying it was too late, but not too late because you have your child alive with you.
Yes,
so you are one of those lucky mothers.
So we thank God
If
for
it was
that.
too late, you probably would not have been here.
For sure.
Yeah,
For sure.
and of course, thank you, Christine, for being with her through the journey.
Thanks very
But just tell us, Christine, uli handle aje? Were you given medication? And how did you realize it was almost too late? I don't want to say it was too
Yes,
late.
yeah.
So there was no medication. Reason being, I didn't know this, like it was preeclampsia. Daktari aliniambia ni kama uko na twins. Already nilikuwa nimefanywa scan like yesterday, kwa hivyo hakukuwa na haja nayo tena. So I was having that baby boy. I was carrying that baby boy and it was a little bit hectic kwa sababu I could not move even.
Ni kwa nini alikwambia uko na twins? Because of the weight?
Yes. The way I was looking. Nimechoka. Na ananiuliza, are you sure? Are you sure about your due date?
Did they do tests?
Yeah. Are you sure? Are you sure about? Yeah.
So Christine, in short, pia madaktari, they can fail to determine
Of course, yes.
preeclampsia.
And that's why we cannot even mention them. So alikuwa ananiambia twins and then I'm like, hey, ijasema hivyo. The scan ijasema hivyo. So I was like, what is happening? Then someone is asking me, am I sure about my due date? You see? And I'm very, very much sure about my due date because I started doing the scans earlier enough. So it was a bit terrifying in my mind.
I know.
Also, sharing it with someone else was a bit hard because how do I start telling my husband about I'm carrying twins, yet tukienda na yeye anaonanga ni mmoja? How do I tell that? Then I was also in fear that anaweza kuwa kakijana, anaweza kuwa kasichana.
Ulikuwa unataka mvulana?
Mvulana. So I was very much in fear kuambia mtu, nimeambiwa ni boy. Then I come and fail. Then on the other side, I'm waiting to give birth normally.
Versus expectations.
I'm expecting to give birth when I'm normal and everything because I was active. But Sasa, this is not the case. It started hitting me in my mind. Something must happen.
Okay.
Yes.
So the doctor says you have twins, you might be... What, overweight? You're
Overweight,
eating too much.
I'm feeding
so
very much.
What did you do after that? Like, how did you now get treated for preeclampsia?
No, I didn't get treated.
What happened?
I didn't get treated.
Drum rolls.
Yes. Someone has told me ni mtoto amekuwa heavy, amekuwa mzito na ni kama siyuko sure about my due date. So I was not treated. Nilienda nyumbani.
Ukaenda nyumbani.
Which is this someone? Maybe she can tell us which someone is this that told you.
For the purpose of...
The doc. You know,
the doctor told you rudi nyumbani.
Kumbuka, naenda to the best
health facilities. So even the best health facility can miss that diagnosis.
Very dangerous.
Daktari, naona unawashwa.
Siwashwi. Ninakuwa na just preparing myself to talk.
Nilitumia.
So ukaenda home.
Nikaenda nyumbani. So I went on with my things. I'm calling my friends here. Nawaambia kuna shinda mahali.
So daktari is your friend?
Not even my friend, like my friend. Ni daktari.
How did you get
to know her? Because alikuwa mwalimu wetu. Yeah. So someone mwenye alikuwa jirani yangu, the lecturer, nikamwambia hapa si kuzuri. Actually, Gerard, big up so much. Nikamwambia hapa si kuzuri. Something is happening. Nimeambiwa mtoto anakuwa mkubwa. Kaniambia hapana. You have a lot of stress. Reduce the salt. Nikamwambia I don't take salt. Akaniambia hata nikionja chakula yako inakuanga very salty. So nikapunguza hiyo. Drink a lot of water. Achana na kazi mingi. Kazi mingi na nazunguka hapa pale. So I was very comfortable.
So you were active.
Very active.
You are feeding well. Being a nutritionist.
Yes.
Of course you would know what to avoid.
I feed a lot of fruits.
So
vegetables.
Hii preeclampsia ulijuaje uko nayo?
Nilienda nikapeleka mtoto salon, my firstborn. Na nikasema I'm coming also for the hairdresser. So vile nilienda nikasikia nimechoka sana. Kwa hivyo hata siwezi chuna spinach beside my kitchen garden. Nikasema let me have a nap na kuja. Ku have a nap by waking up at 5. Nimesikia nimechoka totally. I cannot even turn myself on the bed. Hey. And someone told me, kuna my grandma aliingia kwa nyumba akaniambia, Christine ni kama umefura. Nikamwambia hapana, daktari aliniambia na overeat. So I'm trying even to reduce nikule a lot of greens.
Uko 34 weeks. Did you deliver your child at 34 weeks?
Yes.
Okay. Sasa tueleze hapo how it happened. Daktari,
Yes.
Mulikuwa na yeye.
What happened is this. I was seated in my house. It was late at night, and I get a distress call. I'm also a community midwife, by the way. I work a lot with the community. So I get a distress call, and the only thing she told me, nakufa. And that was it. That's how I picked myself up, and I went for her, and I took her to hospital. When the BPs were done, there were over 200, over 100, and I think 40. That is a BP that is high.
Very high.
That is a high BP, and that is when we realized this woman is having preeclampsia, and she had to be put on medication almost immediately, and a decision on how to help this child now. What do we do for the baby had to be made at that point.
Okay.
So she was admitted.
She was admitted.
Yes.
Na tuachie hapo.
Yes.
It's time to take a short break. Of course, we are talking about preconception during the pregnancy and also delivery, labor, na the risks, the killer factors za maternal health. We will talk about preeclampsia more, how to prevent it, how to treat it when we come back. Don't go away. Welcome back. Na kama umetujoin hivi sasa, my name is Chebet Birir. This is the Health and Wellness Show, and we are talking about maternal health, maternal deaths and safe deliveries, how to prevent maternal deaths and how to increase the number of safe deliveries in our country, of course, and beyond. And on set with me, niko na Dr. Odhiambo Nderitu, ambaye ni daktari and also a researcher, and she has specialized in midwifery. Kwa hivyo hiyo mambo ya kudeliver akina mama ako sawa kabisa. And then tuko na Christine Kome. She's a nutritionist, but most importantly a mother. Before we went for a break, she was talking to us about preeclampsia, a condition that she experienced during her first pregnancy. And tulikuwa tumefika penye Christine now is alikuwa anasema it was too late, but I would like to say it was not too late because she was saved and she got to deliver safely and she's here with us. So Christine was telling us, tuendele, you have met Daktari Odhiambo, amekupeleka hospitali, you have been admitted. What were your fears?
Death.
Thank you. Death, of course.
Death.
I would imagine.
Death, because I was expecting that we are going home. We are going back.
So ulikuwa unajua utaenda uone daktari rudi home.
Mimi nirudi nyumbani, but it was not the case. So nikaambiwa wewe unabaki hapa. Nabaki hapa, yes. But I feel I'm okay. You're not okay because already you're crying about the pain here.
Pain under your rib.
So nikakati hapo. Ningoje sasa. Now hata kuketi siezi keti. Siezi lala.
She was very restless.
It was very uncomfortable and very, very uncomfortable. It kept me feeling that I'm now dying because it is not at the due date. It is already 34 weeks. They're even confusing me. Am I even sure if these are not the labor pains? For them, they were not even sure because I met nurses, not doctors. It was already late at night. So it came to my realization that even I cannot, the hospital itself, they don't have the scans. So I have to get somewhere else to be given the scan.
Tuachie hapo kidogo. So you say that you went to hospital, you're almost dying, but yet after admission, nobody has attended to you.
Yes. Just painkillers.
I don't want to ask which hospital was this.
No.
This speaks a lot. I mean, like we said for the first segment, lack of proper care, ama neglect kwa hospitali. Of course, tumeongelea about what we can do to prevent these deaths.
Of course.
But daktari, please tell us, ni nini hao nurses ama madaktari wanafaa kufanya ku prevent hizi maternal deaths?
First and foremost, let me put a point here. And as we've been approaching to talk about the delivery part now, safe deliveries and all that, I want to say that safe delivery is not a privilege.
It is not.
It is a right. And once we have that mindset, even us as healthcare providers, we will be able to uphold respectful maternity care.
And we can write a whole book about respectful maternity
care. And respectful maternity care, what does it entail? It simply means you're treating me as a client with a lot of dignity, with a lot of respect. You are not abusing me. You are respecting my thoughts and what I feel and all that. At the end of the day, that has to be there. Because all women, like I said, we are all different.
Yes.
In fact, your labor may not be like mine.
Yeah.
Mine is very terrible. I can't even explain it. Yours may be very smooth and all that.
It is very terrible.
There's a lot that factors that play in it. Yeah. Now, as I continue with that, I would like to say that sometimes errors do happen. Yeah, and I can even give an example of myself. I went to the hospital and I was mismanaged, and yet I am in the medical field. I was mismanaged. You see, this fluid that we are normally put for, so that at least it can enhance the pain that the women have.
Yes.
I was put for, and it was put to run. There's a way we put it to run. We start by 10 drops per minute, but mine was running like, you see tap water? It was running like that. So what I did, sorry about this, but these are experiences we have, and sometimes we have to voice them. What I did is that I told the nurses, please let me regulate from, because I know how to regulate.
You know
so
your stuff.
And I asked myself, at the end of the day when I delivered, I asked them, is this what you do to any client? If me, I'm not a lay person and I can be treated this way, what about the other person who doesn't understand?
What is going on?
So I told them we have to do something about it, and we had a very big discussion. Now, that aside, I would like to also say that the reality on the ground sometimes is too... It's something that is also very hard
different.
to... it's different. It's really different. What we talk about out here and what we get on the ground. And that's why I insist. Birth preparedness for all women is important. Now, Birir, I heard you talking, saying that this show is for women. Wacha niwaambie. All the men out there who are listening, please pull your seats. Come close, because we need you to be participants.
Yes.
Why can't a man accompany the wife to the clinic? Why can't a man accompany the wife to the labor room, so that they can be able to also to experience and appreciate this process?
And I agree with you, because kama sasa were you alone, Christine?
Yeah.
You were alone.
She was alone.
I don't want to point fingers, but I'm just saying, for example, if Christine was with someone, ameka hapo the whole night, I mean, your partner would have raised alarm, aseme ai nimeleta my wife na mume.
No, you are not doing anything.
So I understand what you mean when you say partners should support their wives as they go to deliver, because that support enhance the care. Mtu ata raise alarm akiona your wife has been neglected, right?
Yes.
So I totally agree with you. Na pia hapo nataka tuongelea hapo kwa nurses.
Okay, all right.
There's a lot of stories online, by the way, about public hospitals sana hiyo mistreatment. Mi nakumbuka yangu trauma, lakini ni sawa tu, nilihil. But kama Christine vile anasema, umekaa tu hapo, nobody, you are dying, you know. So what needs to be done to ensure that these nurses, they treat mostly nurses, because they are the first line
who will receive the client first.
Maternal deaths. Unapata nasa anakuambia, wewe unafikiri wewe ni wa kwanza kuzaa wewe? Hebu tembea hiyo labor progress.
You must have had it rough. The way you're talking.
Me, I remember kneeling down, naambia nurse nisaidie tafadhali. Ananiambia, imagine hakuna vile naweza kusaidia, labor ni njia yetu sote. Wewe pambana. So what needs to be done?
I will summarize that in this way. Attitude. If we don't instill the correct attitude in the nurses that are coming up, and I'm talking like this now from the point of being a lecturer in an institution, that is where we start. How are you bringing up this future nurse? If we don't have the correct attitude, that is, in fact, I normally say in nursing and midwifery, the killer is attitude. When you don't know what you're doing, and by the way, aside from knowledge and skills and expertise and all that, you may be very good in what you do, but you slap women, you abuse women, you tell them all manner of, okay, how did you come here? Who sent you here? Look at a teenager who walks into your clinic. She has come to deliver. How judgmental, the judgmental attitude is, wewe sasa unasoma ama una kazi yako ni kupata mimba. You know? And I think this is something that we really need to come. We are really working hard, and I know there's a lot of challenges on the ground, systemic issues and all that. But at the end of the day, we can try. I normally say, because I cannot change the whole world, just one person can make a difference. And
One
it starts
person
by
can
you.
make
All
a
the healthcare
difference.
providers who are listening to me today, the change starts from you. When you have the correct attitude, you will know what to do and how to handle your patient, including respectful maternity care.
Respectful maternity
Yes,
care.
that
Thank you
is the
so
word.
much, Daktari. Christine,
Yes.
sasa tunaenda kwa delivery.
Yes.
How were you treated and how did it come about paka ukadeliver safely na sahi paka mtoto wako sawa?
Yeah, the first pregnancy was very okay, and the process was very nice. It was a public hospital, the first pregnancy, and it was very, very, very correct. But the second pregnancy was very hectic, although the nurses were very nice, but they were not sure about my condition. So now we are taking an ambulance to go to get the scan out from the hospital. So it took like 30 minutes to go to the scan. Na kufika hapo, the doctor was like, mnafanya nini na huyu hapa? Go back very fast. And it became an emergency thing.
Yeah.
So I had to enter to the theater to sign. I was very thirsty. Amwezi nipea maji, amwezi nipea kama tunda baridi.
Tujuni surgery.
So, yeah.
Yes.
So ingia CS. I'm not siingi CS kama
And were
amjaniongelesha.
you were not prepared for CS. Well,
I
ulikuwa unajua
was not,
because I
yes.
gave birth normally with my first child, of course,
I'm
automatically.
very much okay with that. And I'm very energetic. I was feeling energetic and I'm okay because I was feeding healthy. Everything was perfect. So ni masaa ya kuingia CS.
Okay.
What do I do? Ni kusign ni nini? I'm alone. Actually, my husband was away. Job issues. What am I signing? Death. Ai, nikaanza kulia. Nikamwambia huko sitatoka. Nileteni my firstborn, nimwambia goodbye.
Yeah, we had to bring that baby.
Wow.
We had to
You know, harakisha. We have to go there. Kwa sababu mtoto already amechoka.
Amechoka, yes.
The heartbeat, they were very low.
The heart rate was
My pressure was very high. It was 210.
210
Yeah.
140.
So it was not very nice.
So it was an emergency CS.
CS.
Yeah.
Nikaingia nikatoka sikumaliza 15 minutes and that was very, very good. Kuona mtoto. Now the problem was siwezi mnyonyesha. Stress.
Yeah,
It
because
was very, very stress. Siwezi hata lala na mtoto wangu kando.
The baby was tiny.
Yes, 1.9. I don't know how safe was that, but whoever that gave me the instructions aliniambia it is not safe. But nishukuru Mungu the way niko uhai na mtoto wako uhai. And I said, what? Mmenimaliza sasa kabisa. Yeah, then the edema was very high, so mguu mmoja nafikiri ilikuwa 40 kgs because if I step down nilikuwa nasikia a lot of pain. So hata kutembea kufika kwa NBU, the newborn unit was very, very hard. Yeah.
But you managed to overcome all those challenges and now your babies are okay? And you're also okay?
Yes.
We thank God for that.
Amen.
Sasa we utatueleza how to the do's and don'ts after daktari.
Yeah.
Especially sasa now that you are a nutritionist. Utafanya hiyo wrap up yote.
Yeah, sure.
But daktari, tell us.
Yeah.
Haraka too, we have very
Yes,
little time.
I can see that.
Tulisema 1 hour is very little.
Of course, Biril, you have to do better.
So just tell us.
Yes.
What are the highest killers, the biggest killers of maternal mothers during pregnancy and during childbirth? Tumesema preeclampsia.
Yeah.
So tell us how to prevent that and how you treat it, and then also talk about all the others, hemorrhage, anemia. Izo, you are the expert. Please go.
So I will do it as a summary, really,
Yes,
because
yes.
I can see that our time is up.
Yes.
Now, of course, we have categories of those conditions. We normally coin them as obstetric conditions. Obstetric conditions are the ones that come as a result of the pregnancy and also during birth and all that. So there are complications that are anticipated that can occur. The leading cause of death of women is hemorrhage, bleeding disorders. I don't know if we've heard of postpartum hemorrhage. That one occurs after you've delivered. Then there's another one that occurs during pregnancy, past 24 weeks, but before the labor, that is called antepartum hemorrhage. Now, those are the killer conditions of women. Any woman who is dying from as a result of pregnancy will come because of bleeding.
Yes.
Other bleeding conditions like maybe the woman had an abortion, an ectopic pregnancy that, burst open and there's a lot of bleeding. And then, of course, the second category is now these hypertensive disorders. And we have mentioned preeclampsia, which can graduate to another condition called eclampsia. Now, eclampsia, together with all the symptoms of preeclampsia, will present with convulsions. So this woman has all the symptoms, high blood pressure, edema, and all that. But again, they have convulsions. Now, this is a complication of preeclampsia. We also have others, obstructed labor, labor that is not progressing. You have gone to deliver in the labor room and nothing is happening. You're there, you are 2 centimeters from the time you came yesterday up to today. We are still at 2 centimeters, or even if we progress, we are just moving 1 centimeter at a time. So that is a very, very big issue. Of course, now we can have obstructed labor, which will definitely lead to prolonged labor. So a woman who is having obstructed labor, there is a problem with the delivery process.
Yes.
At the end of the day, something is preventing that process from completing properly. And that is how now you get women getting complications of fistulas. If you people have heard of fistulas, those openings, those holes that actually form because of the difficult nature of the birth.
Yes.
So we can have fistulas and all. And those are very, very sensitive conditions women have, and they lead to a lot of stigma. Many of them don't even talk about it.
That's
Yes.
a topic for another day.
I know.
A whole segment.
Exactly,
Fistula
yeah.
And other complications. Asante sana, Daktari.
Yes.
Christine, please tueleze, what should mothers do? Preparation, nutrition, lifestyle, and also expectations versus reality, because it's important to prepare psychologically, whether you'll have a normal delivery or a CS. Ukwe too prepared, because, you know, it could go both ways.
Sure.
Please tell the mothers.
Yes. So for the mothers here, not everybody who is ready for the pregnancy or is sure about the taking care of the inner being that is there. So at times we tend to think it is cravings. Acha niende chips because I'm craving for it, but it is not very healthy. About the fatty foods are not very healthy. The processed foods, like the way I was taking a lot of Coca-Cola sodas, they are not very healthy. They lead to some things. So I would like to tell even the young mothers or the mothers that are there saying that leo niko na cravings ya 1, 2, 3, it is not very good, because at the end of the day you are not minding about the future of the unborn. So sometimes it is very, very good to be very ready about whatever that you are feeding to get taking care of the unborn.
Thank you. Thank you so much, Christine. Thank you so much, Daktari. We would want to go on, but unfortunately, Ambiwa, time is up. So thank you so much for coming to the show. And wherever you're watching from, of course, thank you so much for tuning in to this episode of Health and Wellness. We've talked about preparation before you conceive. Prepare. After you conceive, go for clinic visits. Go to hospital for checkups. Get a gyna if you can, so that you can prevent all these complications in good time. Of course, tunasema ya Mungu, delivery is, for me, I say childbirth is a miracle. So, but you do your best and you let God do the rest. Also remember that postpartum healthcare is very important. Take care of your mental health. Take care of your child. Asanteni sana for tuning in. This has been a very good show. My name is Chebet Birir, and have a wonderful evening.
Health and Wellness, brought to you by Brookside.
Brookside Plus, a fiber-fortified whole milk, will provide you with the essential fiber that you require in your body. For this reason, therefore, pregnant women, children who are not able to meet their daily requirements for fiber intake, or even people who are suffering chronic constipation would be able to use this product to provide bulk in their food.